Well, hi, it's Jan Schakowsky, and I am here with Jan's Plans and Pans this week. Last week, I was in Rwanda. What an amazing country. This is a country you may remember in 1994, almost 1 million people were killed in 100 days. And I'm talking about machetes and guns and people that were locked into churches and burned. In 1994, the person who was the current president was leading an army and that actually stopped the genocide. Though he didn't become president until the year 2000. I want to tell you something. Rwanda is amazing. This was a country, of course, devastated in infrastructure and human infrastructure. Everyone was totally traumatized by the genocide in Rwanda. If you went there today, you would see a country that is really beginning to thrive. The streets are all paved, and you see these wonderful investment that's happening there. You notice how clean everything is there, and even more importantly, you see the programs that they're doing to raise the level of economy, of healthcare. We met with the president who was talking about human rights, and he says, to me, access to healthcare is a human right. My friend Dr. Paul Farmer was there. He's built a teaching hospital. We're seeing nutrition programs that are stopping children from being stunted. So I was really impressed. Went with the Aspen Institute and a number of members of Congress. We went all around the country, saw power plants being built, saw water systems happening. So if you get a chance, I would suggest that you look into Rwanda as an example of a small country in Africa that I think is headed in the right direction. The other thing, I've been all over the community. I went to an LGBTQ event with leaders of the gay and lesbian, transgender communities just yesterday. And one of the things we talked about was the Trump administration's plan that went into effect in May that says that healthcare providers ranging from doctors and hospital board members to receptionists in a doctor's office can make decisions about who gets treated based on their religious or personal preferences, feelings. They may not schedule an appointment for you if you don't look like, maybe you look like a trans person, or I don't know, for whatever personal or religious reason, they decide that they don't want to schedule that appointment. So there's certainly the danger for women who may be accessing the full range of reproductive care, to transgender and gay people who are at risk of someone deciding to turn them down for health care. And speaking of health care, you've heard, I'm sure, that Planned Parenthood is no longer going to be able to take Title X funding. What's that? That's the biggest program, the only program by the federal government that funds family planning, birth control. And the reason is because if you want that money, you can't even suggest the possibility of going somewhere else for an abortion, or doctors who might provide abortions, and you certainly can't provide abortions with different money, not federal dollars, in a clinic. This is a very bad time to be limiting resources to Planned Parenthood because states are shutting down so many healthcare centers, community healthcare centers, that Planned Parenthood, 1 out of 5 American women goes to a Planned Parenthood clinic. And so we have to be supporters of Planned Parenthood, and we have to be opposed to what they're calling the gag rule. And that means that doctors can't even talk about abortion, even suggest it. And finally, I wanted to just say that yesterday, August 22nd, is the day that Black women's equal pay day. What does that mean? That finally, the average African American worker, woman, has now, as of yesterday, well into the third quarter of the year, made as much money as the average white man has made last year. Last year, in 2018, the whole year. And guess what? That's even better than women who are waiting, Hispanic women, Native American women who haven't hit that mark yet. And so I am pulling for equal pay for equal work for all women. And that's my plans and pans for this week. I'll see you next week.